The Vatican has issued an update regarding Pope Francis's critical respiratory crisis. On Sunday morning, the Vatican issued an update saying the 88-year-old had a tranquil night after suffering a critical incident for a complex respiratory illness on Saturday. The brief update came after doctors said the Pope was in critical condition. On Saturday morning, he suffered a prolonged asthmatic respiratory crisis while being treated for pneumonia and a complex lung infection. Pope Francis had previously had part of one lung removed in his youth and has dealt with numerous lung issues since. The Vatican said in an update that the Pope had received high flows of oxygen to aid with breathing and also received blood transfusions after tests showed low counts of platelets, which are needed for clotting. The Vatican went on to say, "The Holy Father continues to be alert and spent the day in an armchair, although in more pain than yesterday. At the moment, the prognosis is reserved." Doctors have said the main threat facing Pope Francis is if the infection enters the bloodstream, a serious condition known as sepsis. As of Friday, there was no evidence of sepsis. His personal physician, Dr. Luigi Carbone, commented on the Pope's health, saying, "He is not out of danger, so like all fragile patients, I say they are always on the golden scale. In other words, it takes very little to become unbalanced." Francis, who has chronic lung disease, was admitted to hospital on February 14th after a week-long bout of bronchitis worsened. Doctors first diagnosed a complex viral, bacterial and fungal respiratory tract infection and then the onset of pneumonia in both lungs. They prescribed him absolute rest and a combination of cortisone and antibiotics along with supplemental oxygen when needed.